Ladies and gentlemen, welcome. My name is LJ Stambuk. I'm the president and CEO of the World Affairs Council of Charlotte, and I have the pleasure, the exquisite pleasure today of having with us Eugene Woods, the CEO of Atrium Health, and Dr. Julie Freischlag, CEO of Wake Forest Baptist Health and Dean of Wake Forest School of Medicine. We will be discussing the topic of setting the national standard with COVID-19, investing in life-changing care for all. Thank you both for being here with us today. Let me also thank Dr. Derek Raghavan, who is going to moderate this conversation. Dr. Raghavan is the president of the Levine Cancer Institute. So as you all probably know, the World Affairs Council of Charlotte, as the community's premier global education nonprofit, nonpartisan organization, has always sought to bring the world closer to you and to build a community of internationally informed and engaged citizens. Dialogue, knowledge, active participation, and understanding of global issues are vitally important for our democracy to flourish at all levels. A little bit of housekeeping. Your microphone will be on mute and your camera turned off for the duration of the presentation. To submit a question for our panelists, email the World Affairs Council team at info@worldaffairscharlotte.org. The Atrium Health and Wake Forest Baptist Health teams will respond to you after the program. Please note that this presentation will be recorded, so please make sure that we have your correct email, as we will send the recording to you to your email address. As 2020 comes to a close, we at the World Affairs Council of Charlotte are very grateful to you for continuing to support our mission. As I indicated, we're the global education nonprofit in our community, and we're proud to continue serving our community. We're truly thankful for your support, and we ask you to consider making a year-end contribution in order to help sustain our vital place in Charlotte's civic landscape. Thank you so very much. And you can see the council scholar teacher, Anthony Vanina from Carolina International School with students in Peru. That's one of the programs that the World Affairs Council has with teachers in the community. 2017 World Affairs Council scholar Natalia Jones-West from Charlotte High School in Peru, and 2018 World Affairs Council scholar Nicole Beverly from Rama Road Elementary, teaching at the Akili Prep School in Kenya. Thank you very much for being with us. You can follow us on social media, and once again, do not forget YouTube. All the Distinguished Speaker Series programs are on YouTube, and you can watch them as you have time. And now I would like to introduce to you Dr. David Calloway, a doctor in the Atrium Health System and also a World Affairs Council board member. Dr. Calloway. Dr. Calloway.
Thanks, Dave. My name is David Calloway. I'm the Chief of Operational and Disaster Medicine at Atrium Health and a member of the World Affairs Council of Charlotte Board of Directors. It's an honor to introduce our distinguished speakers today, both of whom are highly respected and inspirational global leaders. The first of our dynamic duo is Eugene Woods, President and CEO of Atrium Health, a national leading nonprofit system with more than 70,000 teammates, serving patients in 42 hospitals at more than 1,500 locations, and the payer of my paycheck. So glad to have you here, sir. During his nearly 30 years of healthcare leadership experience, Gene has made a considerable impact on his system and on the industry, having previously led nonprofit and for-profit hospitals, academic and community-based delivery systems, and rural and urban facilities. He was formerly the president and chief operating officer at Christus Health, where he oversaw acute, post-acute, and international operations for facilities in the United States, Mexico, and Chile. He also previously served dual roles at Catholic Health Initiatives as CEO of St. Joseph Health System and as the senior vice president responsible for implementing national initiatives for a faith-based organization operating in 18 states. As one of today's most prominent leaders in healthcare, and I'm not just saying that to butter up to him, he has been active on several boards, including time as the chairman of the board of trustees of the American Hospital Association's Equity Care Committee. In this capacity, he was instrumental in driving more than 1,700 hospitals and health care organizations to sign the 123 Equity Pledge to eliminate health disparities and work towards greater equity. He is also a member of the Becker's Healthcare Advisory Board and the Wall Street Journal CEO Council, and he serves on the board of Best Buy and deputy chair of the board of the Federal Reserve in Richmond. Most recently, Gene was appointed to the North Carolina Council for Healthcare Coverage and Governor Roy Cooper's Economic Recovery Task Force, as well as the governor's Andrea Harris Social, Economic, Environmental, and Health Equity Task Force to help address the disparities in communities of color that have been exacerbated by the COVID-19 pandemic. His career is decorated with many honors, including his most recent recognition as the #7 of the top 100 most influential people in healthcare, and as recipient of the Charlotte Business Journal's 2020 Businessman of the Year, the 2020 Distinguished 400 Award by the 400 Years of African American History Commission, and one of the 50 Great African American Leaders. The list goes on, and in fact, one of the few honors Gene has yet to win is a platinum record deal. He has a very diverse music portfolio, though, and if you get on YouTube, you can see a video starring our very own Mayor Vi Lyles. Gene is native of Rhode Island, but lost his Ocean State accent while growing up in Spain, where his father was stationed in the U.S. Navy. His mother was born in a small city called Jerez de la Frontera, in a region that has a strong history of both festivals and sherry and Andalusian horses and music. And this is probably where Gene got his love of music and flamenco dancing and good food. This served him well as he played in bands to pay for college at Pennsylvania State. And we're really lucky to have him down in Charlotte. Our second speaker, equally distinguished, is Dr. Julie Freischlag, Chief Executive Officer of Wake Forest Baptist Health and Dean of the Wake Forest Medical School and Chief Academic Officer of the Atrium Health Enterprise. As CEO and Dean at Wake Forest Baptist Health, Dr. Freischlag has had the overall responsibility for the health system's clinical, academic, and innovation enterprises and its annual operating budget of over $3 billion. Dr. Freischlag has helped to drive change in academic medicine with a deep commitment to diversity and inclusion. For more than 15 years, she has led education and training programs at top medical schools in her role as a professor and chair of surgery and chair of vascular surgery across different institutions. Dr. Freischlag has more than 30 years of experience leading patient care services as the chief of surgery or vascular surgery at nationally ranked hospitals, including Johns Hopkins and Wake Forest Baptist. And she has served as the chair of surgery and surgeon-in-chief in several of these positions. She has led initiatives to expand research and specialty clinical care services, to improve patient-centered care and patient safety design, and to redesign surgical programs and enhance academic careers for faculty. Just in case she's not impressive enough, a brief sampling of her national leadership includes serving as former governor of the Board of Governors and the past chair of the Board of Regents for the American College of Surgeons. She's also the past president of the Society for Vascular Surgery and the Society for Vascular Surgery Foundation, and a past president of the Association of VA Surgeons and Society of Surgical Chairs. She's a committed and very well-respected academician, where she was editor of the Journal of American Medical Association JAMA Surgery for 10 years, and a member of the editorial boards for the Annals of Vascular Surgery, Journal of American College of Surgeons, British Journal of Surgery. And she was recently named to the JAMA editorial board. She has over 250 manuscripts, abstracts, and book chapters, and is a prolific academician. Currently, she serves on the executive board Association for the Academic Health Centers, the Council of Deans of the Association of American Medical Colleges, Aga Khan University Board of Trustees, University of Pittsburgh School of Medicine, and the list goes on. I think it's nothing short of remarkable that we have both Gene and Dr. Freischlag here with us today. And together, Gene and Dr. Freischlag are leading the combined teams at Atrium Health and Wake as we fundamentally reshape health and healthcare, both in the Charlotte and North Carolina community, but across the nation. So it's my privilege and honor to serve on their team and to welcome them here today to speak with us. Thank you, LJ.
Thank you very much, David. Gene, Dr. Freischlag.
Great, thank you. Well, it's really good to be here with you today, and to be here with my partner, Dr. Freischlag. In addition to all the accolades that were mentioned, she's also a practicing surgeon. So so it's very exciting to have this opportunity to speak with you. It's been quite a year like no other, and as we look to turn the page on 2020 and start 2021, we're here to talk about really how we invest in life-changing care for all, but as much as anything, that this really marks the start of a new era. Certainly in our country, as we look to 2021 and finish out this decade and start another one, certainly in our country, but also in what our organizations are coming together to do, and also what it means for the community. And that's really what we want to talk a little bit about today. Next slide. Dr. Callaway mentioned this a little bit, but to give you a little bit of level setting, the organization will have 70,000 together teammates, as we call them. We'll have 42 hospitals and 1,500 locations. And we'll be saying grace over 7 million lives, if you will. So that's when Dr. Freischlag and I think about this enterprise, we're really thinking about it, how do we provide better care, life-changing care to the 7 million patients or community members that will have access to one of our facilities. But if you peel back the numbers and just look at what's behind them, today we'll have about 5,000 patients that will come to one of our emergency rooms looking for care. We'll have 100 babies that will take their first breath in one of our facilities. We'll have 1,000 surgeries that get done. So I think that's the impact that we're looking to have behind the numbers, is actually how it affects real lives and real people. Next slide, please. If you look at the economic impact together, actually from day one, and day one was early in October when we came together, we're about for $32 billion impact. And what we had an independent study look at this, and really we support, in addition to 70,000 jobs that we employ, there's another 110,000 that actually, whether it's vendors, supplies, construction workers, that we also affect, if you will, because of our health systems and the work that they do with us. Next slide, please. The one thing, though, I think, so we shared a little bit of numbers. This is really a people business fundamentally. And I think what I would say that Julie and I are most proud is the combined spirit of our team, especially this year. It's tested all of us. Nothing has tested us more than COVID, than the racial intolerance that we've had to be on the front line as well, all the economic challenges that we've all seen. But I think what we're really excited about is just really the teams that have come together so well. You'll see in one of these slides here, on the slide, there's a little sign there that says, "We stay at work for you." And that's from coming from Winston. And so I think that's really sums it up in my mind. You'll see another sign there that also says, if you can read it, it says, "Please stay at home for us." And that's part of the message we want to deliver, is that, notwithstanding the excitement of the vaccine, which we'll talk about in a second, we're really still facing a really challenging time. We have more patients hospitalized at our facilities than at any time in this pandemic going back to March. So we wouldn't be doing our jobs if we wouldn't say, please stay home, please wear a mask, please social distance, wash your hands, so we can get through this and get to the next holiday season with all our loved ones and friends around us. Next slide, please. So the one thing I do want to talk about is, what happened on Monday, which was, we were one of the first in the country to be delivered the vaccines. And I will say that it will be a day, December 14th, that we will all remember for the rest of our lives. I now bring this little vial with me. I was there when the teammates got vaccinated. This is one of the first Pfizer vaccines that were used, and we really there's about 5 shots that come out of this, so you can get a sense for that. But we the first 20 that got vaccinated on a COVID unit, there were doctors, there were nurses, there were unit secretaries, there were pharmacists, there were a lab tech. If you think about a lab tech's job in a COVID unit, is to go into the rooms with patients that have COVID and test them to make sure that we're taking care of them appropriately. So putting themselves in harm's way every single day. So to see them get vaccinated, to be there, is a moment that we'll never forget. So we're really excited to be among the first in the country to really have this life-saving vaccine delivered to our frontline teammates. Next slide, please. The one thing I'd ask Dr. Freischlag to share a little bit of it, and it's part of why we're so excited about this combination, is WACC was one of the first in the entire country to participate in the Moderna trial, for example. And so we believe the ability to be on the front lines of also developing vaccines and being clinical trial sites is something that we can bring to the community as well. So Julie, I'll turn it over to you to share a little bit more about that.
Sure, we were so excited about the delivery of the vaccine as well this week. But during this time, we have actually had 49 COVID-19 clinical trials either underway or complete. And this ranges from community surveillance of COVID, studies which tracks the virus spread, which is so important, to tests that we look at antibodies for COVID-19 along with PPE alternatives and therapeutic treatments. We've enrolled patients, as Gene has mentioned, into 2 COVID-19 vaccine trials, the Moderna and Janssen. And actually, I'm the #1 patient in the Moderna trial, so I can't wait till it's approved, hopefully this week. The surveillance trial has enrolled 25,000 study participants, and that's what's so great about our teams and all the patients that we take care of. And every day we fill out a short survey about how we're feeling and other things happening to us, so we can look at symptoms and look at spread. Understanding how this disease spreads, especially now, as Gene says, both of us have the more patients in our hospitals than we ever had in the past. We need to monitor what happens with the vaccines as well as the spread as well as the pandemic goes forward.
The other thing that to add to that is, we do have some unique therapeutics that we use with different populations. We actually have one of the highest enrolling locations in the country for a pediatric remdesivir therapeutic trial. We're also in the beginning stages of actually having that going into our hospitals at home. So I think the work that our teams have done together, even before we came together as a new organization, is really paying dividends at this time, and will continue to. Next slide, please. The question that we always get is, and the excitement is around Charlotte's second medical school, the Wake Forest School of Medicine. It'll be the first for Charlotte. This is the largest city in the country without a 4-year medical school. And so we've already started working on that. Hopefully in the first quarter of 2021, we'll be able to share more details. I think the community is going to be extraordinarily excited about the location, about what's contemplated for the site. And so we're looking forward to sharing that more broadly at that time. I will say that there's been such a spirit of collaboration from the mayor's office to the county officials to the businesses, all really leaning in, because I'll talk about this a little bit more, but Julie and I really see this as much as anything as a community asset. And so we want to make sure everybody feels part of it going forward. But have Julie, the next slide, talk a little bit more about medical education and how we're thinking about it.
Thanks so much. So in 1902, Wake Forest School of Medicine was founded as a 2-year program dedicated to the promise of educating compassionate, highly skilled physician leaders. Today, we train nearly 1,900 students and fellows, including physicians, basic scientists, and allied clinical professionals on our Winston-Salem campus, and we're ready to grow. And with this combination, we are creating the future of medical education. Wake Forest Baptist Health and Wake Forest School of Medicine will be the academic core of Atrium Health, with the second campus of the School of Medicine in Charlotte. We'll be one of the largest educators of physicians and other medical professionals in the state, educating over 3,500 total students across more than 100 specialized programs. In fact, this year, probably due to the excitement of this combination, we received more applications to our medical school than ever before, about 11,000. And it's more diverse, 734 Black African American applicants and 777 Hispanic, 54% female. So we're excited. The first cohort of 3rd-year medical students will start rotations in Charlotte in March.
Great.
Next slide. Now, we also have an innovation district that we're very excited also to spread from Winston-Salem down to Charlotte. Through our combination, we'll be able to be a magnet for business startups and innovative organizations looking for partners to collaborate, such as the antibody trial, the vaccines, the therapeutics, as Jean mentioned, to do that, as well as other equipment and devices and ability to diagnose and treat. We'll be able to look at products from our research developments, clinical trials, as well as care innovation. Next slide. So research is a very important part of what we do, and the impact of this strategic combination will be far-reaching. Expanding research in signature areas such as cancer, cardiovascular, regenerative medicine, and aging are really four of our top ones. Bringing research breakthroughs to the community in less than half the time of the national average is our goal. We want to advance large, multi-site, patient-centered research collaborations like what we've done with COVID-19 for prevention and treatment of high blood pressure, diabetes, obesity, hypertension, vascular disease, and others. And we're going to invest in the first-of-the-kind translational research and population health center in Winston-Salem, giving patients access to thousands of clinical trials across the region. Back to you, Jean.
Thank you. Next slide, please. So what I think is a bit unique if you look at research corridors throughout the country is we're looking to have a corridor from Winston-Salem to Charlotte, and really we have a tremendous IQ operation there in Winston. We will have one in Charlotte too, and connect. And this is really where we'll be attracting scientists and inventors and business folks, mingling with the students to really invent new things. And I think if you step back, and we had another independent study look at this, by 2040, we anticipate really creating another 20,000 jobs. And these are obviously STEM type jobs, if you will. And so we're really excited about this. The other thing that is connected to this, as North Carolina continues to recruit more businesses that have life science orientation, one of the things that we're hearing, there's not enough workforce that's connected in that way. So we think as we had conversations with the governors and others, that we believe we can be an organization that helps recruit other companies, because we'll be training the next generation of clinicians, life scientists, and so forth. Next slide, please. The one thing that's extraordinarily important to us is really the centerpiece of our work is going to be around social impact and eliminating disparities and inequalities. If you think about just the number of medical students that are Black today in the country, it's about 6 or 7%. Population demographic is about 13%. So there's a huge gap there. And so what Julie and I spent a lot of time, and we'll continue to discuss more broadly, is we'll connect with Title I schools, and we'll make sure that we get a pipeline of diverse students. As Julie said, we've already had the most diverse application pool. Now we're looking to convert that into actually students that we can train for the future. Next slide, please. The one thing I would say that's as important as anything that we're going to say today is the intention is to really use this and serve it as an asset for the community. We're looking to partner with businesses, other learning organizations, and the government. And one of the things I would just highlight, Julie and I have had a number of conversations with the new chancellor at UNC Charlotte. And I'm not sure the community fully appreciates that UNC Charlotte awards more baccalaureate degrees to African Americans in the state other than North Carolina State. So also one of the highest, number one actually in the state for awarding degrees to Latinx students. And so that's another way that we will be partnering with another learning institution. We're also doing some research together so that it does become and feel like a community asset. And so we'll have a lot more to say about that in the year to come. Next slide, please. The other thing that's really important, and obviously for this audience as well, is the idea of international health. What we've know, and all of us, many of us remember Dr. Robichek's work, who he started off and he's a towering figure. We lost him this past year, but as Mr. Hines, who was a former chair of our board, said, he was really an international giant, starting work from Guatemala to Nicaragua, Salvador, Honduras, and so forth. So we already have a connection internationally that we look to expand. I think you can't do this work without having ultimately an international presence. And if you just think about how we're connected, you look at the Pfizer vaccine, you know, it was developed in concert with a German company and a husband and wife team. One was from Turkey, one from Greece. They were immigrants. And so it really, this COVID vaccine is really a collaboration of scientists throughout the country and throughout the world. And so really, this is solidified in our mind the importance of recognizing we're in a global community. Dr. Raghavan will remember that back in March when we were trying to figure out really more about COVID directly from those communities that have been affected, he organized a team to have a conversation with the doctors on the ground in Wuhan, China. So this idea of health really has to be going forward a global endeavor. And I know that Julie and the team have also had the same orientation, and maybe Julie, you can share a little bit more about that as well.
Yeah, it's a very important aspect of how we learn and are able to be better healthcare providers. I serve as a trustee on the Aga Khan board, and that's myself and my husband in Africa about a year and a half ago. And actually watching how they've had to deal with the COVID-19 outbreak in Karachi and Nairobi, as well as in Kampala, Uganda, has just been really tough. And not only not having enough physicians, but not even having ventilators or access to the vaccines in these freezers because they don't have them. So we've learned a lot from that. And our students do participate in global health education. Part of that has had to be paused because of COVID-19, but 21 members of our class of 2019 had a global elective in their fourth year. And we have affiliations with Tokai University in Japan, UCI EdMed in Costa Rica, and the Universidad de Navarra in Spain. And we also have a global health certificate program. Our ENT team also has a partnership with Hainesbrand in the Dominican Republic, and has actually built a hospital there where they go every year, at least once or twice, but not in the last 6 months, to take care of children in Banahaw. And the ophthalmology team travels to Honduras to perform cataract removals, laser surgery, and cornea transplants. So all of that is very important, not only to give care, but also to learn more about what the global communities face.
Thanks, Julie. So I think we wanted to kind of just set up the conversation a little bit, and Dr. Raghavan, we'll turn it over to you. Next slide, please, with respect to a little bit about who we are coming together and some of the things that we'll be focused on early in our combination.
So Jean, Julie, thanks for that. That was very inspiring, very important. So what I took away from that, you guys between you cover about 7.3 million people. Now, if you add together the population of North Carolina, South Carolina, and Southern Virginia, that's about 19 million people. So you've got a pretty dramatic footprint for clinical care. And I heard you say 70,000 teammates and 1,500 care locations and a $32 billion financial impact. So you obviously have tons of spare time, and you've intimidated everybody. So Julie, let's start with you. So in your spare time, I question the fact that you were the dean at Davis, which as I remember it is right in the middle of the Napa Valley wine tasting country, and you left there. So there must be some element of your life that doesn't relate to medicine or wine drinking. What do you do in your spare time?
Well, I actually still belong to many wineries from Napa Valley and Sonoma Valley. There's a couple good ones now in North Carolina as well, too, so we enjoyed that. I actually came all the way back here because I knew we were going to partner with Atrium Health.
Froze up just a little bit.
Just froze up there. So while we get Julie back up, Jean, we heard the two lions that you have at home.
We enjoy crafting as well.
We lost you there for a minute, Julie. So the last.
I know. There I am, right there. So I actually do a lot of handicrafts, crafting, swimming, and reading. Those are mine.
Okay. And operating and opening people's chests at High Point Hospital as well in spare time. I don't think people realize that with all the things you do, you still operate. And I hear that your figures are pretty good. Jean, I know you don't operate in that way, I heard the two lions in the background that you have at home roaring while you were talking. Tell us a little, you just produced a CD. From what I'm told, you weren't eligible for the 2020 Grammys, but have hopes for 2021. How did you do that? What was the story there?
Well, I don't think I have aspiration for 2021 Grammys either, but I tell you, in the middle of everything that we were dealing with, one of the things that the team, we typically do an annual talent show, and it is one of the most remarkable things. And you were a judge at one of them, as I recall. We had him, of no surprise, sort of dressed up like Simon Cowell, so you can kind of imagine that. It's always been something that's really important to the team here, and we have auditions throughout the system when we have the last 12 that make it. And this time we had to do it virtually, and there's actually a Grammy Award winning studio here in Charlotte called GAT3, and we had all our finalists go there, and they asked me to also participate, not as somebody that was going to be judged, but and so I was able to do one of the songs that I wrote back when I was in my 20s called Not Enough Joy. And what I realize now, our mission at Atrium is health, hope, and healing for all. And it was really about how we need to, especially at this moment, reach out to each other, be a little kinder to each other. And I just thought that the song right now had a particular resonance to it. And it's been mostly heartwarming to hear the feedback from the team.
Julie, you probably don't know that both Gene and I competed in Dancing with the Stars for the ballet. And so now next in line is either you or Dave Calloway. So just be ready. David, why don't you turn your camera on, because I do want to engage you in the discussion that's coming up. So let's talk seriously now for a couple of minutes. We've covered some really important topics so far. So let's talk a little bit more about COVID and the vaccine research. So we're excited. There are two vaccines. We're doing a lot of clinical trial work at both ends. Julie, what's your feeling about the population? We've been fortunate in having a governor, and down here in the Mecklenburg County commissioners, and I know up in Winston-Salem commissioners who've been very responsible and been very careful about safety. There's been an economic cost of that. But now that vaccines are available, do we need to be socially distancing and masking? What do you think about that?
Well, it seems like we still do, because even though you've taken the vaccine and we're going to be able to prove that you have antibodies, as they've unveiled the results from Pfizer and Moderna, they do work. However, we're not sure that you can't transmit it, even if you've had the vaccine, or you can get it. This is a funny virus. You have people that get the virus and don't even know they have it. So keeping it socially distant, wearing your mask till at least 70–80% of us are vaccinated is critical. And many of us have seen patients. I've had a recent patient I was going to operate on from Asheville. He met me, went hunting, didn't wear his mask, got COVID. So we waited 2 weeks so I could take out his rib. He has a clot in his subclavian vein. He's still positive this week. He feels fine, but I can't operate on him. We're going to have to wait another month because you could get inflammation and clot. So even though he's 21, feeling healthy, he still has the virus. So we've got to maintain that distancing, masking, and then get the vaccine. I think all of that together will hopefully in the next few months will get us to a place that resembles where we used to be.
One of the things that I find fascinating, we're really dealing with an onslaught. Unfortunately, while I think we all understand that people felt the need for a break and took Thanksgiving off, both in Winston-Salem at Baptist and down here at Carolinas Medical Center and at Pineville and at Union, we're basically running out of beds. Maybe David Calloway, you could step in. You're on the front lines. What's your view? Do you know if the other hospitals are being hit as hard? Awake Forest Baptist and we doing much of the heavy lifting. How's that playing out on the front lines?
Well, thanks, Derek. I was told specifically I should not ad lib or go off script, but thanks for the opportunity. I think we all are getting hit across the region and across the nation. And so the unique aspect of this disaster is that there's no one part of the country that is unaffected and can come to the rescue of another part of the country. And so, I am, wherever you look, everyone is straining at capacity, both for physical space, but think more importantly, which we talk a lot about, is with human workforce and our nurses and our frontline respiratory therapists and our techs, these people who are day in, day out, on the front lines, crushing it, trying to keep people safe, and then going home and trying to, educate their kids and make sure that their children are having meals and learning to read. I think that's the stress point. And I think right now we're at a point where we have a lot of hope. This should be used to motivate us, but being a military guy, this is the second half of a deployment. So this is where it's dangerous, because we need to keep our guard up. And Dr. Freischlag said this: we need to keep wearing masks. We need to keep physically distancing. We're on our path to recovery, but we need to keep taking these acts of faith and these acts of service and do the right thing so that we actually can recover.
So I want to switch gears a little bit and talk about what I think is one of the most exciting concepts is the innovation corridor. The Wake Forest Innovation Center is, I think, internationally famous and highly respected. You've got Tony, Natalia, and the Regen Medicine Center that we down here have all been dying to have access to. And I'll comment, Julie, that two of my lead scientists and I are driving up to spend a socially distanced and masked day with Tony in January. And we have a couple of plans of projects to do together. But maybe, Julie, as you've got such a track record for developing the innovation corridor in Winston-Salem, how are you thinking about extending the interface down here? Gene has a vision, which I've been fortunate to see. How do you see those two ends of the corridor working as a syncytium, adding to a 1 + 1 = 3?
Right. Well, I think it's really exciting, because I think some of the strengths of Charlotte are different than that in Winston-Salem. So we'll be able to amplify our partnerships with businesses in Charlotte. UNC Charlotte, as Gene mentioned too, is an incredible university that actually has sent us students in the past as well. So we'll be able to look at the mechanism, how we did that, which is all about innovation, getting a scientist together with a business person to look at not only developing something, but also getting it out to the individuals into our patients. We have a Department of Implementation Science that Christy Foley runs, who's worked a lot with people in Charlotte. She actually lives down in that part of the state, that we are able to actually take things that are, wow, she'll tell you, like something you invent or a technique or a mechanism, and then she'll tell you how to do it so that you can get it into where the patients are, similar to what we've seen with the vaccine trials, that we're able to get vaccine in patients' arms within less than a year for this disease. So I think we'll use some of the innovation activities and also this telehealth. Atrium Health really was far ahead of us using telehealth. Now we know how to use it. So having conversations and discussions, meeting people all over the country and the world that actually can implement change and differences in both innovation quarters, I think is our future as well. And the students, they're so smart. So using these students as well as all the learners that are already in Charlotte with the nursing school and allied health, the residents, all of that together, I think is just a great calculation for future success.
You mentioned something, Julie, that I think is really important and that people may not fully recognize. And that is the kind of yin and yang of WACC and us working together. I've long since forgiven you for stealing Christy Foley from us, because she and I ran a pre-med student program when she was at Davidson College. And we, I guess, between us produced about 10 physicians who went through Davidson and are now established docs around the place. But the point I was going to make is that there is such a cultural interface. You know that I've been working with your director of research, Greg Burke, who's such a nice guy. You've got your head clinician, Kevin High. And one of the things that I think was clever about the way you and Gene did this was you took a look at all the systems that tried to get together and failed. And there have been many legendary failures around the country. And you learned from that. And I think thus far, you've avoided the problems. You've thought very strategically about getting the groups together and getting us to know each other and kind of getting comfortable together. And I think one of the nice things has been how pleasant the interface has been and how well people are working together. Gene, do you want to comment on that? Because I know you spent hours thinking this through, and as you and Julie were putting this deal together, the two of you thought through this. Maybe you could, people will be interested to know how you've made this work so well.
Yeah, well, everybody talks about culture, and that's really the underpinning of any successful relationship. You see the mergers, and I've had the chance to see the combination across the country. The reason why they ultimately don't work is culture. I mean, you can get all the structures, all the plans, and on paper it could look wonderful. And I think there were some key elements of culture that Julie and I really established from the beginning. There is such a commitment to excellence. These are organizations and clinicians and people that want to be the best in the world, not just the country, in the world. And why? Because we want to bring that kind of world-class service to our communities. And so I've been in a lot of organizations that there's a commitment. There's who's doing this, where are we, compare that. So I think that was one of the elements of culture. And that there's and when clinicians and others get together and say, how can we be best together? That's magic. But I think there's also, what was very, very important is, you got to check your egos at the door. Part of, and what I've said from the beginning is that is you have to have a humble approach to discovering and listening to what's best about each other. And I think it's sort of a natural inclination that we had going into this, but Julie and I named it more specifically. The leaders that will succeed in this organization are those that are committed to excellence, that have a certain humility, and that also have a connection to community. I think that's the one thing that we will be tripling down on, is our connection to community. Sometimes you have these big academic centers that do great work, but are thinking about things like this, and the community doesn't know who they are. That's not going to be us. That hasn't been us. But I think if you take about what we've done, from food insecurity to affordable housing, the Maya Angelou Center that's there in Winston, we pull that together. So those are the pillars that I see are key elements of the culture. Why is this humility, it's this commitment to excellence, and this engagement in community. And we started from that place. Now it's a matter, and as you know, Derek, our physicians, our administrators in Charlotte are oriented that way anyway. So we didn't have to force people into that. We have to name it, continue to refine it, can't take it for granted, need to move forward. But I think that's what makes this different than the combinations I've seen in other places of the country that have failed. And so we start from a really good place. Now, as we continue to build things together, it's just how we refine that and how we continue along that journey.
I think that both of you have long records of commitment to the underserved, and that's been a unifying theme. It's kind of interesting, Julie, you'll know this, but possibly Gene, you don't, that in a short time, as soon as this session is finished, I jump onto a conference call between WACC and us, which is looking at developing a working party to focus on research, medical research, and underprivileged people. And it's really exciting when you think about it, because one of the chairs is Goldie Bird, who's the new chief of the Maya Angelou Center. Another participant is Ronnie Bell, who's a member of the Lumbee Indian tribe. And we've got a whole collection of people who have a background in underserved population research. And I think that's very exciting. Julie, you did this at Davis, you've brokered it at WACC. One of the unifying themes that made us all recognize that the bracketing of WACC and Atrium was a natural is we've both done a lot of the heavy lifting in this state for underserved and underinsured populations. So I don't know the numbers at WACC. I know that Atrium expends a couple of billion a year in supporting care for underinsured people. But maybe, Julie, this has been a passion of yours. Maybe you could just walk us through it. It's not unnatural for the former chair of surgery at Hopkins, and yet it's so much part of you. So just talk us through how you got into this, how you feel about it, how you see the two groups coming together, because I think it'll give people a real insight into who you are.
Sure. And I'm a vascular surgeon. So part of the way I trained really was to do procedures, right? In the 80s and 90s, could we do these procedures? How do we cure vascular disease? And it was only as we got longer into that, did we realize we need to prevent the disease? And I've worked a lot at VA hospitals, and as you have VA hospitals in our system as well. And when we looked at the veteran and figured out who did better and who didn't, there were many people that didn't show up for surgery. And what we would do is just overbook it. We would have 2 or 3 cases, and we would just assume that a couple wouldn't come in. And we didn't realize till we asked questions why. And a lot of it had to do with their social determinants of health. They didn't have people at their home. They didn't have food to eat. They couldn't take their medications. And as I looked at better outcomes in my vascular patients, it was the ones that got attention on that did better, those that could quit smoking, that took their medications, and that were able to be treated. And when I asked a patient once who was 80-some years old with a big vascular procedure, I said, what makes you look so healthy these days? And he said, well, I drive the bus for the old veterans to come in. And it's when I realize it's helping others that makes us all get better. That's where you end up. And all of us are going to say, you can't have a healthy population unless everyone has access and everyone has ability. So part of it is learning prevention, social determinants, understanding that everyone should have access and a chance to get better. And certainly COVID-19's pointed that out too, for those that are really not able to access the system, are not healthy themselves. The food insecurity has just been devastating for the populations. It makes you realize that we're not all healthy until we all are healthy.
Well said. You know, one of the things that you put out as a teaser, both of you, was the whole issue of global health. And I think you focused on how we outreach to underprivileged countries. And that's part of the segue of saying, not only do we look after our own underprivileged as 2 systems now working as one, but we reach out internationally. I think that one of the things that I have always been impressed with, having come here from the Cleveland Clinic, which is a great hospital and thinks of itself as an international magnet, I didn't realize how many stars we have at WACC and at Atrium. You know, Ed Levine brings patients from around the world for his abdominal bath approach. You've got Dave Ioannidis, who trains hepatobiliary surgeons from around the world. Our radiation facilities are world-class, and as we all know, but may not be known to the World Affairs Council, we're about to move forward on a proton beam project, which will be physically located in Charlotte, but will have input from Wake Forest. So we do attract a lot of patients from around the world, but you teased us, Julie, and you also, Jean, with just a throwaway line about virtual health. Jean, you've invested very heavily in the technology of virtual health. We've got major things happening in our IT system. You hired Andy Crowder, who's a national legend in informatics, and Julie has strength there. Can you talk a little about how you're going to leverage virtual care in global health? Both of you maybe address that. Maybe Jean, you first.
Yeah, well, you know, this organization really invested in virtual health 10 years ago when, and up until recent, nobody was paying for it, right? And so, but we realized that that at some point in the future, people would recognize the importance of that. COVID certainly, I think what COVID did is pulled us 5 years into the future, certainly as an industry. But we had already been there. I think the difference about how we do virtual health in this organization versus what I've seen in other organizations is, in many organizations, it's about buying the best, latest technology. If you don't have the physicians and the clinicians helping to drive that and setting the protocols, that it will never take. And so when COVID hit, it wasn't just that we had the technology, but our physicians already knew what the protocols were. So if you look around the country, and other systems, satisfaction with virtual care health was during COVID was pretty low. Ours was among the top. And I think it's because of that interplay between the technology and the physicians and the clinical staff that I think has put us as a leader. I think when you know, I say, you know, a crisis is the crucible of innovation. And in the middle of COVID, when we didn't have enough beds, and I remember a team coming to me and saying, we don't have enough beds, but we have this idea of a hospital at home. And we think we can deploy it. We can probably get 250 patients in there immediately. That was tech, that was physicians, that was protocol, that was community all coming together. if you would have asked me in January whether we would have had a hospital at home, which is basically converting your home into a hospital bed, if you will. But if you would have told me that we would have treated 30,000 patients that otherwise would have been in our facilities, I could not. I would say, well, maybe in 3 or 4 years we could, but basically by the time the idea was presented, the time we implemented was 2 weeks.
Yep.
And so I think that infrastructure is what will continue to allow us to lead, and we will bake that into the innovation corridor. We will bake this whole idea of simulation. You know, rural care is extraordinarily important. We talked about the urban poor, but rural care. And so what this organization will be able to do with the combined talents that we now have is you could be 2 hours from here without an infectious disease specialist or without the right cardiologist, or you know, you need a surgical consult, and we'll be able to beam in to your home, and really you'll have the best access to care. So these are things that are all foundational. We show a picture of students in how we're envisioning the medical school, and you sort of have a 3D patient in the middle and students are surrounding it. That's not science fiction. That's something, it's a virtual reality approach to learning that we will be implementing, and it's a virtual technology, it's telehealth. So that's one of the things that we're very excited about. Everybody has learned about telehealth in this thing, but we have the capabilities, I think, to really redefine it and take it to another level.
And Julie, up at Wake Forest, you're doing similar things. Can you expand a little on some of the unique things that you're bringing to the table in this space?
Well, we need to thank you because we just started our hospital at home this week, mainly because we learned from what you did, and we're really impressed when we visited your telehealth piece. What was interesting during the beginning of the COVID crisis, we pulled the medical students out of the hospital because we didn't have enough PPE and all of that, and put them on virtual visits. And a couple of the students actually said, well, this isn't real medicine. Are you sure we should be doing this? And of course, it's great medicine. So now we're going to be able to deliver medical students who have experience doing this so that they actually can access patients too. We've really flipped too. I tell you, my post-op patients, I can't even imagine bringing them back in. I operate on people from all over the country as well too. And I just did a post-op visit in Arizona last week and saw a patient in Mississippi last week. And so to me, now I don't even know, why did I ever bring people back in to say I'm fine? I didn't get paid for it anyway, so why were there? And you love seeing them in their home. So I think we've learned so much about the hospital at home, the ability to take care of patients, and then also to learn, patients love it, because especially our older patients, those with children, we also use it as a screening tool. Do you need to come into the emergency room? Do you need to come into my office? Or can you see your primary care doctor either in person or virtually tomorrow? So I think we've learned from each other through this about how we both can do that. And we've really committed to look at rural access and rural care, as Gene mentioned, because that's one thing that we both have big rural areas and are within minutes of all the rural hospitals throughout our system. And we need to be able to give them the care similar to the veterans. Everyone deserves access to the best care, whether virtual or in person.
You know, you make an important point, both of you, and maybe just as a public service announcement, when we look at California and when we look at New York, and particularly early in the pandemic, when they ran out of beds, they weren't using the creativity that you two guys have used. They didn't have hospital at home. And the fact, as Gene mentioned, we had 30,000 patients in hospital at home. So the fact that we're running out of ICU beds and running out of beds tells us that right now, North Carolina and South Carolina community is not paying enough attention to masking and social distancing, because we're being overwhelmed despite having used so many protective measures to help the community to be well through this period. So, you know, I think that's an important point. Some people have said that this was a figment of the medical profession's imagination. That's just not true. This is a pandemic. It's killed 300,000 people in America, 1.6 million people internationally. And I think, you know, the people who are watching this, who are mostly opinion leaders from WACC, World Affairs Council of Charlotte, need to be proselytizing that information. So we're pretty close to time. I'd like to close on a positive note. And so each of you, maybe Gene and then you, Julie, you've really covered so much. Looking to the future, Gene, what is the most one or two most exciting things, the things that you think will be the most impactful, the most fun for you to preside over in partnership with Julie. And then Julie, I ask you the same question.
Yeah, again, I've served David shared some of the experiences I've had through my career. So I know what large systems are doing throughout the country. I've participated in many of them and internationally. I just don't think, in my humble opinion, there's a greater platform in this country on the health side to do two things. One is to really drive social impact, and I'm so excited about that. And to drive innovation, what healthcare 3.0 looks like. Those are the two things that, for me, when I someday hang up my cleats, I want to look back and saying that we created something, we invented something that, and redefine how healthcare should operate in this country. And it's not just aspirational, it's within our reach. And then also that we can look at the other communities, we can hotspot the communities that are much better for us having been together than they would have been otherwise.
Mm-hmm. Julie?
Yeah, and I think we're learning to be flexible. You know, I think the key to making it go forward is exactly what Gene says, being flexible, being innovative, and saying why not as we go forward, and going a little faster. You know, our communities really want us to go a little faster. I've done some great clinical trials that we came up with great discoveries, but it took us 10 or 15 years, and we don't have that anymore. Our communities really want to work with us, whether it's vaccines or treatments or new innovations, and our new students and new learners are ready to go too. We will not have a person in the hospital that has not been on telehealth, used electronic records. Everyone is now ready to go with this, and it's the new norm. So I'm excited to stay flexible and open-minded so we can solve problems of the future.
Thank you both. So this has been a very interesting discussion. I appreciate both of you being crisp, not bringing too many slides, being very clear. You talked English, not techno-speak. And we've covered a lot of stuff in the last 45 minutes. The Next Gen Academic Center, partnership between WACC and Atrium, the Innovation Corridor, vaccine research, COVID-19, global health, and looking after underserved populations. I think in closing, we've got a storm heading this way. I remind everyone that Dave Calloway is famous for being a crisis manager and having a system that he can deploy every time there is a crisis in the region. And so, David, I hope you get a good night's sleep tonight because you'll be busy later this week. Thank you both for a very stimulating and exciting session. If people have additional questions, I tried to field all the advanced questions that came in. But if you have additional questions, send them to Jesse and LJ at World Affairs Council, and we'll try to get answers to you. So let me turn it back to you, LJ. Thank you.
Thank you so very much, Dr. Raghavan, for so ably moderating this very interesting discussion we had. Thank you so much, Gene Woods. Thank you so much, Dr. Julie Freischlag. Thank you, Dr. Calloway. I believe that our present is very good in your hands and our future is even better. Thank you for all that you're doing. We're so excited to have you in our community. We're fortunate to have you in our state and community. Enjoyed your conversation and presentation today, and we look forward to hearing more good news from you both as we go forward into the new year. We all hope that 2021 will be a much better year than 2020. We hope that the vaccines will be available and implemented the right way, and we know you will do the right thing with the vaccines and with the health of our community. With that, I turn it over to Wayne Cooper, the board chair of the World Affairs Council of Charlotte. Wayne.
Thank you, LJ, and I echo your comment. What a great group of folk today. I tell you what, our programs just keep getting better and better. And Gene, I want to glad to hear you mention Dr. Robichek. My fishing buddy is Dr. Jacob Majaro, who's a heart surgeon there with y'all, who worked very closely with Dr. Robichek. And I tell you, we claim at World Affairs Council, we always claim Dr. Robichek as our very, very own. He meant so much to our group. Before we close, I want to, number one, commend LJ and excellent staff for putting these programs together in this very, very difficult time. But as we close out the year and you're writing checks, think about year-end giving to the World Affairs Council. It would really, really help us. and help us continue bringing these type of programs to you. With that, we want to close and adjourn until our next meeting. And with that, happy holidays, everybody.
Happy holidays.
Thank you.
Thanks so much.
Thank you.